We're going to chat a little bit about diastasis rectus abdominis. So first of all, what is diastasis rectus abdominis, also known as DRA? So DRA is a very common occurrence during pregnancy and even in the postpartum period. And what it is a stretching or a separation or thinning of the connective tissue running down the midline of the abdomen. So if we have our two six-pack muscles, this tissue is running just in between these muscles, down the middle of the tummy, through the belly button and down towards the pubic bone. And as baby starts to grow and as the abdominal wall starts to stretch, then we can get some thinning of this connective tissue, which is also known as the linea alba. So how do we assess for diastasis? So the simplest way to assess for this is to lie down on a yoga mat or on a bed and simply lift your head up off the table. As you're lifting, you can observe what's going on through the wall of the abdomen and just around where the belly button area is. And as you look through that area, we want to observe if we see any bulging of the tissue, if there's any doming or otherwise known as tenting that's occurring. So we'll see that the abdominal wall, rather than being flat, will start to kind of push up like this. Or what can also happen is instead of a doming that occurs, we can actually get a sinking of the tissues, or almost like a ditching. So you'll see a little bit of a gully down the midline of the tummy. So these are some common presentations of diastasis. So if there is a diastasis present during pregnancy, what do you want to do about it? Well, first of all, you want to watch your body mechanics in whatever you're doing, whether you're exercising or if you're carrying out any day-to-day activities such as carrying bags, lifting toddlers, etc. We want to try to minimize as much as we can through that midline with regards to excessively loading that tissue. So anything like sit-ups or excessive straining can actually create more intra-abdominal pressure through that region, and so we want to be really careful of this during pregnancy. If a diastasis is still present in the postpartum period, this is something that a pelvic health physiotherapist can help you resolve. And there are different exercises, different ways to coordinate breathing with core activation exercises that can be very helpful to gain back the tension through that abdominal wall so that we can minimize that doming or that sort of sinking in of the tissues. So it's important to note that, of course, diastasis is common during pregnancy, and it is normal because the tissues do have to stretch to accommodate baby. However, if you do observe it, take note of it, watch the way you're moving, and perhaps consider seeing a pelvic physiotherapist for rehab in the postpartum period.